Michael Lascomb knows the stakes of a hiring decision are higher than most people realize. He has seen how delays in credentialing, mismatched expectations, or gaps in coverage can ripple through a hospital, limiting its ability to care for patients in critical moments. For him, recruiting is not just about filling positions. It is about making sure the right physician is in the right place at the right time. The hiring process in healthcare is still slower than it should be, said Lascomb, who is based in Philadelphia. And speed matters when patient access is on the line. As senior physician recruiter at Sevaro Health, a tele-neurology company that provides real-time coverage to hospitals across the country, Michael Lascomb manages a role that blends talent scout, strategist, and trusted advisor. A senior recruiter identifies top physicians, guides them through interviews and negotiations, and ensures they are prepared to deliver care where it is needed most. The work requires both technical knowledge and people skills, from understanding licensing timelines to earning a candidate's trust. With more than 8 years in healthcare staffing, Michael Lascomb has developed a reputation for pairing efficiency with integrity. He does not view recruitment as transactional. Instead, he sees it as building teams that save lives. Recruiting in healthcare is not just filling roles, he said. It is connecting the right talent to organizations that impact patient lives. At Sevaro, where specialists often join hospital teams virtually within minutes, his ability to evaluate talent and match physicians to opportunities ensures patients experiencing strokes and neurological emergencies receive expert care without delay. The impact is felt immediately at the bedside, even if the physician is hundreds of miles away. Long before he specialized in healthcare staffing, Michael Lascomb was a 4-year starter on the Immaculata University baseball team. The Diamond became his training ground for strategy, leadership, and resilience. He learned how to trust teammates, focus under pressure, and stay disciplined over long seasons. Baseball shaped how I approach business decisions, he said. You cannot succeed alone. You need to know your role, trust your teammates, and adjust when the game throws you something unexpected. The lessons extend into recruitment. Sourcing talent mirrors scouting players. Negotiating contracts requires patience and timing, like waiting for the right pitch. Building a clinical team resembles creating a lineup, where each role must complement the others. And the persistence he developed through practices, games, and long bus rides translates directly to his work in healthcare. You learn not to get too high on the wins or too low on the setbacks, he said. That balance keeps you moving forward. At Immaculata, Lascomb was also a chemistry major with a business administration minor, working in advanced research under Dr. Luna Zhang. He used infrared and Raman spectroscopy to design lab experiments on alcohols, pain medications, and plastics. The precision of scientific research, combined with the problem-solving of business coursework, gave him an analytical foundation that continues to inform his recruiting strategies. He later completed his MBA at West Chester University, blending science, business, and teamwork into a career centered on people. Michael Lascomb's professional career has taken him through nearly every layer of healthcare staffing. He began at Baugh Healthcare in Virginia, working across more than 15 specialties from family medicine to neurosurgery. He learned the complexities of physician visa sponsorships and the art of negotiating employment offers. From there he moved to Maxim Healthcare, where he handled recruitment for home healthcare workers while managing more than 60 client schedules totaling over 3,500 hours per week. His ability to thrive in high-volume environments earned him recognition as one of the company's top recruiters, finishing second in the region and earning a nomination for Recruiter of the Year. At REMD, later known as Collage Rehabilitation Partners, he recruited for more than 30 rehabilitation sites supporting patients with traumatic brain injuries. The work demanded empathy as much as efficiency. He hired more than 150 staff members, from nurses and therapists to site managers, while ensuring the company maintained CARF accreditation standards. Lascomb then spent nearly 4 years at Array Behavioral Care in New Jersey, recruiting clinicians for telepsychiatry roles. The timing aligned with the rapid growth of telehealth during the pandemic, and he gained first-hand experience in scaling virtual care teams. By 2023, he joined Sevaro Health as recruitment manager, bringing together his background in high-volume recruiting, telehealth staffing, and people-first leadership. Each step in his career sharpened a different skill, from compliance and credentialing to cultural alignment and employer branding. Today, those experiences converge as he helps build Sevaro's physician workforce for the future of teleneurology. Michael Lascomb believes telehealth is transforming from a fallback option into the default for acute and specialty access. Hospitals, he said, will increasingly expect real-time virtual coverage. Of course, there will always be on-site staff and physicians at hospitals, he said. But I foresee that telehealth is going to become the default. Stroke and neurology are leading the way, and I see other specialties following. Providers want flexibility and lifestyle balance. Hospitals want measurable outcomes. Telehealth can deliver both, but only with seamless onboarding and strong data systems. Flexibility and data are shaping the future, he said. Remote work makes both possible, but you have to have the right systems in place. Technology has also reshaped his approach to recruiting. Instead of casting a wide net, I can use data, platforms, and automation to target the right physicians and corporate talent at the right time, he said. It allows me to scale outreach while keeping it personalized. Lascomb looks for candidates who are not only excellent clinicians but also adaptable to the virtual setting. The best telehealth providers thrive in a virtual environment, he said. They can build trust through a screen, document efficiently, and stay calm under pressure when technology or workflow challenges pop up. Employer branding, he adds, is just as important as compensation or schedules. Branding is how you show candidates what it feels like to work with you, he said. A strong brand builds trust before the first conversation. Michael Lascomb lives in Media, Pennsylvania, with his fiancée Samantha and their 2 dogs, Jeffrey and Carson. He and Sam are loyal Phillies fans who love traveling, exploring new restaurants, and spending time with family. They will marry in November 2025, a milestone he describes with the same enthusiasm he brings to his work. Their story began on St. Patrick's Day weekend in 2022 at Guppy's Good Times, a bar in Conshohocken. Sam and her cousin stopped in to celebrate, and Lascomb happened to be there the same day. A few weeks later, their first date took place at Barcelona Wine Bar in South Philadelphia and confirmed the connection. With a little luck of the Irish, our worlds finally collided, he said with a smile. Even away from recruiting, Lascomb carries his team-first mentality. Coaching baseball allows him to give back and stay connected to the sport that shaped his character. Traveling and staying active keep him grounded. Meanwhile, family keeps him centered in the relationships that matter most. Looking forward, he wants to see faster credentialing, more flexible licensing, and closer alignment between providers and hospitals. Above all, he wants to keep building healthcare teams that deliver better access and outcomes. For Michael Lascomb, integrity and teamwork are not just words on a resume. They are the thread that runs through his story, from long days on the baseball field, to late nights in the chemistry lab, to the fast-changing world of telehealth recruiting. Each chapter has reinforced the same lesson: success comes from doing the right thing and doing it together. I want every physician I work with to feel like they are part of something bigger, Lascomb said. At the end of the day, it is about putting the right people in the right place so patients get the care they need when it matters most.